Good morning, everyone. My name is Tessa Dooms. I'm part of the COVID Comms Secretariat. Welcome to our fourth wave prevention campaign press conference. Just a bit about COVID Comms. We are a NPO that has evolved from a volunteer network that was set up specifically to contribute positively towards COVID communications in South Africa. And this network has been around since about the beginning of the lockdown period last year, and has grown and evolved to create COVID communications that is accessible to a mass population and public. So today we're going to launch what we're calling our Prevention of the Fourth Wave campaign. We all know that in South Africa we are still in the middle of and going towards the tail end of a third wave that has been fueled by the Delta virus and that has had devastating effects on many populations and communities in South Africa. And so in order to be proactive about this, we have embarked on a Preventing of the Fourth Wave campaign, because we really believe that ending the acute crisis of the pandemic, the COVID-19 pandemic, is absolutely crucial in South Africa for many reasons, including health and economics. Our Prevention of the Fourth Wave campaign really has three main components that we'll introduce today. The first one is prevention, the second being information, and the third being a strong call and pull towards providing prevention and information around COVID-19 and the fourth wave. So our prevention campaign focuses on information around the non-pharmaceutical interventions. We believe that, for 500 days we've been sitting with this pandemic, and the information that has come through around sanitizing, washing our hands, ensuring that we're wearing masks and social distancing has been out there, but it's important for us to keep pushing that. While a lot of information is starting to shift in the COVID space around what we want people to know, we believe it's still important that people focus on the non-pharmaceutical interventions that we have been pushing for. And so our campaign will continue to push for those. But additionally, we'll also be adding a component around a focus around ventilation in the campaign. And we believe that there's emerging evidence around the importance of ventilation and ensuring that people, especially as we are in a space where people are going to work, they're going to engage with one another in social settings, in home settings, that we really increase the volume around the question around ventilation particularly. And then we want to provide information. As we all know that there's been increasing conversations around vaccine hesitancy. And the vaccination program that we believe needs to be run mustn't only be about telling people who are eligible that they should be vaccinating, which is absolutely important. We know from today onwards, anyone 18 years and older will be able to be vaccinated in South Africa, and it's important that everybody who's eligible is able to get the message and is able to register, find a vaccination site and vaccinate. But there's also been a wave of disinformation that has come with that. And a lot of hesitancy and even resistance to vaccines has come with this disinformation. We believe the disinformation needs to be pushed against, but not necessarily just telling people that they're wrong, but providing the necessary information so that people understand what good information and facts are that can counter the disinformation that is really hampering our progress as a country in terms of our vaccination rollout. And so those are the components of the fourth wave campaign: prevention, vaccination, and information, that we're hoping will not only prevent a fourth wave, but get us to the end of the third wave as quickly as possible. We are really, as a country, in need of a pulling together. And we want to have this as a call to action. This is not just about us as COVID Comms giving information to people, but really it is a broad call to action. It's a call to action for people to go out there and make sure they do the right things, like the non-pharmaceutical interventions and vaccinating, but a stronger call to not spread the disinformation that we're finding is so problematic in our society, and to spread good information, to take the kind of resources that we've now put together in a toolkit, in the Prevention of the Fourth Wave toolkit, which is on our website, covidcoms.org, and really spread that. We've put it in infographics, we'll have animations, and various kinds of material that we are about to showcase that will show people in different languages, as many South African languages as our team can put together, exactly what they should be sharing with other people. That is good information, sound information. We pride ourselves on well-researched information as well, in ways that are graphically appealing, easy to consume, and hopefully something that will be compelling in all forms. So we have a show reel that gives an illustration of the look and feel of this campaign and the kind of things that you can prepare to see. So I'm just going to allow for that show reel to play, and then we'll take it from there. Thanks, team.
Thola umoya ohlanzekile. Gcina indawo yakho, imoto noma itekisi kungena umoya ngokuthi uvule okungenana amafasitela amabili ukugwema igciwane le-COVID-19. Thola umoya ohlanzekile. Ukungena komoya ohlanzekile kusiza ngokunqanda ukusabalala kwe-COVID-19. Ukuthola eminye imininingwane, ngena ku-covidcoms.org.za.
Lesekela batamelana, fanang sekgoba. Emela bogojana bya 1.5 meters go katologa bangwe gore o efoge tshwaetso ya COVID-19. Go katologana go thuša go thibela tshwaetšano ya COVID-19. Go tša tshedimošo ka botlalo go covidcoms.org.za.
Qinisekisa ukuba indawo ogonyela kuyo isendaweni engena umoya macala onke okanye ivulekile. Ngaloo ndlela uza kube ukhuselekile ngokuphindwe kabini. Khumbula OV ababini, vaccinate and ventilate. Ukugonya kwanomoya ococekileyo kunqanda ukunwenwa kwe-COVID-19. Ngeenkcukacha ezithe vetshe, ndwendwela ku covidcoms.org.za.
Mokganni, ke ne ke kopa hle re buletse ding tsa difenstere.
Ho bata ka le kantle.
Empa re tshwanetse ho emisa COVID-19. Engwe ya tsela tsa ho etsa jwalo ke ho hema moya o hlwekileng.
Ke sefuba fela mo.
Ho bulela moya o hlwekileng ho bohlokwa haeba re ikemiseditse ho emisa tshwaetso ya COVID-19.
Jwale a o sompolella hore re tshwanetse ho bula difenstere tse.
Ho fela ho le jwalo. Re hloka ho bula difenstere le ha ile hanyenyane fela. Science e netefaditse hore moya o hlwekileng o fela o fokotsa tshwaetso ya COVID-19.
Bulang difenstere nyana mo bana beso hle.
Please open that one.
Molaetsa ona wa bohlokwa wa tsa bophelo o tlisetswa ke COVIDcoms. Etela covidcoms.org.za ho fumana lesedi le fetang mona.
So as you can see, the look and feel and the design elements of this are about mimicking traffic signs, and particularly the caution sign. This is a campaign about sounding the alarm and caution and keeping at top of our minds that it is a whole society effort, and we need to stay cognizant of the fact that COVID is not gone, and that even though some people are vaccinated, we still have a large issue around hesitancy. And so we all need to remain alert in these times and make sure that we do the right things. And so we want to call on everybody to use this information. It's freely available on the COVIDcoms website, and share it with people at home. Use it as a tool to talk to neighbors and friends. Share it on WhatsApp. The way in which we formulate all of our content is so that it is very data light and it is able to share very easily, and again in as many South African languages as we can get. And so we encourage the use of the material in any place, in any space, and are very grateful for some of the partners that have come on board, who will be speaking a bit later as well, who we believe will help not only shape the messages and make sure that they're as good and as impactful as possible, but make sure that we get the kind of distribution across society that we need to keep the messaging around COVID that is positive, that is good, that will reinforce good behaviors, top of mind for all South Africans, and importantly, push against disinformation so that we can break vaccine hesitancy, break vaccine resistance, and get as many South Africans vaccinated as soon as possible. So to take us to the next part of our discussion, I'm going to hand over to the COVIDCom's chairperson, Chris Vick, who will be talking about the rollout of this campaign as well. Chris, over to you.
Thanks very much, Tessa. In case you didn't notice, we've been able to produce what we believe is one of the first communication tools in Khoi language. Our team of translators is growing really rapidly, and we're really happy to be able to provide material in as many South African languages as possible. But in addition to launching our campaign today, we'd also like to appeal to the South African media fraternity to play a greater role in making this basic health information available to the public. We have our platforms, we have partners who get this material out, but there's no denying that TV, radio, and digital media reach millions of people every day. And we really believe the media could play a greater role in massifying these vital messages about COVID-19 and how to combat it. As COVIDComs, we've already made several breakthroughs already in expanding our reach and developing this new distribution platforms. And we particularly appreciate the role of the SABC and MultiChoice, who broadcast some of our information products on their platform as what are called public service announcements at no cost to us. And these have reached many people across the country. We also appreciate new commitments we've received this week from the publishers of Daily Maverick and News 24, who are starting to use our infographics and animated videos to illustrate news articles about COVID-19. This is also increasing our recent impact, and we really salute the commitment of people who are on board already. But we need to do more. For some weeks now, COVIDComs have been calling on the media fraternity to up its game. Although PSAs and inserts are helpful, excuse me, what we really need is for primetime viewers to be exposed to vital public health messaging. We've therefore been in discussion with a number of media houses about what we're calling a primetime challenge. We're calling on broadcasters in particular to make primetime airtime available at no cost, or at least at significantly discounted rates, so we can touch the soapy audiences, the Uyajola 99 fans, the people, particularly men, who watch soccer matches, and the millions who are locked into reality TV. These platforms are currently expensive, but free or discounted primetime would ensure an exponential increase in the reach of COVID-19 messages. Our information products are there. Our appeal is use them. Don't try and make money out of them. Just use them to communicate with as many people as possible. A number of civil society organizations have already endorsed this call, and we'll be hearing just now from the SOS Coalition, and we deeply appreciate that support. We can give more detail if necessary, but essentially we're saying massifying communication during an emergency like the one we face now is the critical thing to do. Some media organizations have already come on board. For example, AdReach, which is a strategic outdoor branding company, has already donated 1 million rands worth of street pole advertising to our Fourth Wave campaign, for which we are truly grateful. Hopefully others in the industry will be inspired to do the same. We've also received a commitment from more than 150 community newspapers that cover all 11 South African languages and reach 4.2 million people. They're going to distribute our content at minimal printing costs. They're going to waive the advertising fees, which means no commission, to ensure we reach some of the audiences that are most in need of accurate, accessible information in their own language. The SABC has responded particularly well and has offered us significant discounts on radio and TV airtime should we be able to provide some corporate funding. The group CEO of the SABC, Madoda Mxakwe, will be speaking about this in a few minutes. But we believe to make the arrangement truly meaningful, we also need corporate South Africa to come on board and to support the flighting of our Fourth Wave campaign material on high visibility platforms across the commercial media. We've undertaken to the SABC that unlike commercial advertising agencies who have suddenly discovered COVID-19, we will take no commission on the placement of any COVID-19 advertising by corporates working in partnership with COVIDComs. This means all your money goes on airtime, no commissions, no agency fees, etc., using the free material we've developed. And we believe that'll make a significant impact on public awareness of the three key aspects of our campaign, which, as Tessa said, are prevention, vaccination, and information. Finally, we'd also like to increase our interaction with the editorial decision makers around how to make better news broadcasts to build vaccine confidence and overcome vaccine hesitancy. Today, we'd like to formally invite news managers to call on us or others in the same space we're working on if there's a need for suggestions or ideas around how to cover COVID-19 differently. At the same time, we'd like to call for greater collaboration between everyone who shares our commitment to use our skills and networks to intensify public communication around COVID-19. There can be no doubt that a renewed national effort is needed to contain COVID-19 by non-pharmaceutical means and to protect our people by vaccination. Vaccine hesitancy is increasing, and so is active resistance. So we need all hands on deck. We need all the communications help we can muster, and we need it now, in as many forms as possible, in as many languages as possible, so that it reaches as many people as possible and saves as many lives as possible. Thank you. I'll now hand over to Important Daba from the SOS Coalition.
Good morning, everyone. I hope everyone is keeping safe and well. I'm from SOS Coalition. SOS Coalition is a coalition that started out in 2008, particularly looking at the SABC crisis. We started out with a number of organizations, academics, trade unions, really people who are interested in the advancement of public interest media, particularly the SABC within the South African society, recognizing the value of the SABC, but also what it contributes towards the democratic project in post-apartheid era. Now, we found this call to be very important because our work really is to ensure that an organization such as the SABC is able to recognize its mandate within the South African society. And this we see as well as a thing that is demanded out of them based on the Broadcasting Act, to say that you have a mandate, to entertain, to inform, to educate. And this call for us is much more important because we have to also recognize the reach and access that the SABC has, particularly when we look at audience penetration. So just besides that, right, and I understand, Chris, that the call extends beyond the SABC. It's to recognize the role that the entire media sector can play. And this is why I think it's important for them, right, as our colleagues, to recognize that this is a public good, right? We understand the context of media and the sector within which it's, like, in terms of the economy, right, and the market-driven sort of desires that they might have. But at the end of the day, we are in crisis, and we need them to recognize that this is something that is much more important. Now, when it comes to the SABC, this is not new. You know, when it comes to for example, the HIV epidemic, we've seen a long history where education and entertainment education, particularly, being used to advance certain kinds of messaging to the public. We've seen this in Cha-Cha and SABC drama series. We've seen this in Intersections, in Soul City, where the content is, in some instances, would be directly targeted at health messaging, but in other instances, there's that are intended to ensure that the audience members receive certain kinds of messaging. And I think in recent times, we've seen this in Isidingo, for an example, where, in fact, I've seen oftentimes members of consumers of Isidingo saying, well, it's interesting how the show like this responds to the times. However, one thing that we've also noticed is that most of the soapies that we've seen play out do not necessarily reflect the COVID context, right? We haven't seen that play out live, you know, as some of the sub-themes that are explored in this series. Now, I say this because you know, Nina Simone makes this point that the artist has to reflect the times. And I also think that when it comes to the content that we consume, and we want it to be expansive content. It can be television content, it can be radio content, it can be drama, radio content, it can be animation, simply to ensure that misinformation is countered, Now, there's another point that might arise to say, well, what about the editorial independence of an organization such as the SABC? Ours has always been to advocate. The SABC is independent, and I'm glad that Mr. Madoda is here, and it's a decision that they take on their own, and it really something that they deem to be much more important as well. So when it comes to that, there's a fine line between us imposing and us encouraging, and I think we are encouraging in this regard, and that must be noted. So yes, we've released a statement in our website. You can go find it. In fact, I'll just quickly share my screen. It's a call that we made with a number of civil society organizations in the past week. So if you want to read the statement, you can go to soscoalition.org.za. It's a statement that really captures what everyone has already said. There's been a number of organizations like Media Monitoring Africa, Right to Know Campaign, Section 27, Open Secrets, IPO, People's Coalition, C19 People's Coalition. And you can also realize that there's a desire, and people recognize, different civil society organizations recognize that this is an important moment within the South African society to say, listen, people have died, businesses have lost capacity to operate, and therefore something has to be done. So yeah, really, for me, I'm just saying that as civil society, we recognize this moment, and it's something that we would have done, and it's something that falls within sort of the kind of work that we do to say, listen, if there's room for you to educate, to entertain, do so, and also recognize the context within which we operate as a society. So thank you very much, Chris.
Thanks, Mpho. It seems like an appropriate time to hand over to Madoda Mpakwe, Group CEO of SABC. Thank you very much for joining us, Madoda.
Good afternoon, everyone. Thank you, Chris. I'll really be very brief. For us, the partnership with COVID Comms is largely anchored within the SABC's public mandate, which is to inform, educate, and entertain. And at the heart of it is the need to advance the national and public interest. So we all know that the devastating impact of the COVID-19 pandemic is felt throughout the country, and the SABC continues to be the credible source of information about the pandemic. We play a key role in creating awareness, sharing information in all our official languages, and this indeed benefits all South Africans. I think at the heart of the partnership with COVID Comms has been the need to use our extensive reach via our television, radio, and digital platforms in order to communicate the key messages in as far as COVID is concerned. And this partnership for us is really mutually beneficial. And we have seen the kind of compelling content that COVID Comms has been able to produce. And I must say, in a very cost-effective manner. We've seen a lot of traction and a lot of positive comments from our audiences on radio as well as television. I do think that the key on this is their ability to produce some of this material in our African languages. A lot of people have really appreciated the ability to really produce and also interpret the terms that are ordinarily complex, and this has really been very helpful. It is very expensive to do this because as the SABC, we always have to ensure that we display some of the programs that duly pay from a revenue point of view, but we're doing it because it is the right thing for the country. We do call upon all the key players in the corporate to support this, because if we have sufficient budget, we would be able to navigate through this, particularly from a revenue generation point of view. The idea really is not to make money on this, but is just to make sure that there are sufficient financial resources to do the great work that we see. We also have great plans that we've discussed with COVID Comms. One of those is the to do what we call digital insertion of some of the key COVID messages. And we'll be using some of our bigger properties like Uzalo, so that the reach from an audience point of view could be over 10 million. We're looking at generations and all of those key properties. Indeed, as Chris said, we have had to discount quite heavily. I do need to emphasize again, it does cost us as the SABC from a revenue point of view. Hence the need to have as many players on board as possible, so that when we go through these prime time slots and in preparation for the fourth wave campaign that they are running, it would be important to have the financial resources to drive this. And we also call upon some of our media partners to also play in this, and it will be really important, because it's all about partnerships to ensure that we increase reach, but also to ensure that the messages are impactful on the ground. And I think lastly for us is the point, and we cannot overemphasize this, to ensure that we massify communication around COVID in all our platforms. We've been doing that. All our 19 radio stations are involved, as well as all of our 6 television channels. And we've also now taken it to the digital platforms. And really at the heart of it is to ensure that South Africans are fully informed, they understand what we're dealing with. But as I said earlier on when I started, fully in line with our mandate as the SABC to ensure that the nation is informed, but to also bring about awareness. And we're really looking forward to our partnership and strengthening and deepening it with COVID comms, and we will take it from there. Thank you very much, and I hope we can do more as the industry to support this. Thank you very much, Chris.
Thank you, my daughter. We really appreciate your commitment to this project, not just for us, but for the people who have access to your various platforms. So thank you very much for your time. I'd like to hand over to Norman Koza, who is with an organization called Green Flag. You will have noticed in our campaign material, there's an unfamiliar set of messaging around the importance of ventilation, which is increasingly proving to be a key factor in combating COVID-19. Norman, if you wouldn't mind just speaking to that quickly.
Thank you very much, Chris. And good morning to everyone. I'm Norman Koza, the chair of the Green Flag Association. Now, Green Flag Association is a public benefit organization. Really, the organization was developed with the aim to help stop the spread of COVID-19 pandemic and other airborne diseases actually in our living spaces, by raising awareness on the importance of good ventilation, or what we call indoor air quality in public spaces. So this organization actually comprises of leading experts in occupational health and scientists, and then also we've got business owners as well who are part of that. So as Green Flag today, we support the COVID comms campaign, and especially when we speak about the WV campaigns, which is mostly to ventilate and also vaccinate. The aim actually is to fight the scourge of the current actually third wave, but also to prevent any potential waves that might be coming, especially the fourth wave. So what we have realized as Green Flag actually was the lack of clear communication about the airborne nature of COVID-19 and the substantial risk of poorly ventilated environments. Despite the overwhelming, sort of like evidence that, accumulated or trapped exhaled air actually is the main source of super spread incidences. With these, actually, we didn't see much of the messages until now, actually. We failed to ensure that public spaces, especially, I think I need to mention vaccine centers as well, public transport, restaurants, shops, and even hospitals are adequately ventilated. Green Flag Association is in response to this. It provides advice and innovative solutions that will save lives and keep the economy open. In other countries like India and our own country, South Africa, where people travel actually to work in Texas, it is estimated that at least more than 50% of COVID-19 spreads comes from unventilated vehicles. A simple measure like educating taxi drivers just to open windows, ideally by 5 centimeters, but even as little as 2 centimeters can reduce transmission by over 90%. And I think this is the message that we need to get there. So we therefore join the COVID comms, calling all organizations, media, and the public to get behind this message of combating and fighting the coming fourth wave. And also we support and encourage the use of carbon dioxide monitors to assess indoor air quality compliance in public spaces, and especially in our vaccine centers, schools, malls, even churches as well. So ventilation, including other baskets of control, will enable us to open up the economy while we're having a practical real-time assessment and enforcement mechanisms. We need to get awareness and education activated, especially on the ground. Having said that, let me invite Mr. Zuza Mbata of Mumba Projects, who played a critical role actually in the ground in getting 6,000 school taxis fitted with practical innovative solutions to keep them ventilated. Mr. Mbata, let me give it to you. Zuza, are you there?
Yes, I'm here. I was waiting for the admin to connect me. Thank you, Mr. Kosa. Yes. Ladies and gentlemen, I greet you all. My name is Zuza Mbata, and I'm the director of Mumba Projects. As Mumba Projects, we strongly support the double V campaign, which is vaccinate and ventilate. We believe that if we all get behind this, we can decrease the impact or even prevent the fourth wave and the devastation it causes to lives and livelihoods. We wish to emphasize also the critical importance of on-the-ground efforts that allowed us to achieve a certain amount of success. In 2020, we were able to fit 5,000 scholar transport vehicles and 1,000 work transport vehicles with COVID-19 risk mitigation interventions. These are very simple interventions. One, what we actually fitted in the taxis or in the vehicles, it was a sanitizer dispenser to allow the passengers to be able to to sanitize their hands as they get into the vehicle. The second one is the window stopper or window stoppers for the purpose of ventilation or fresh air. We were also able to to educate the 6,000 taxi drivers, both school and work taxi drivers, about the importance of ventilation, with the aim of them actually relaying the message to their passengers. While we were waiting for the vaccination rollout. And that initiative is themed as the Green Flag Safe Passage to Work and School. Now, as on-the-ground active organization with expertise and also active in Alexandra Township and working with communities or the community there, we're able to to successfully start in Alexandra. And we're able also to broaden out the same initiative to the rest of the province of Gauteng, which is we're able to to cover about the 5 regions of Gauteng province. Now, we as Mumba Projects, we call upon other like-minded organizations in communities who are on the ground, who are activists like us. We also challenge both the private and the public sectors to support the same organization, the on-the-ground companies in the delivery of this very critical message. by supporting them with necessary resources for them to be able to effectively to carry out the message. We as also a Mumba, we believe that the message should go to communities, but now the question or the big question is how? By involving churches, other public leaders within the communities, and also influencers within the communities to spread the communication of vaccination and ventilation. We urge all citizens to heed the call to adopt what we call it as the double V approach, which is to vaccinate and to ventilate, as well as the other known non-pharmaceutical measures, which we all know, which is to mask up, to wash our hands, and social distance or distancing. In conclusion, we believe that by taking these steps, we can be able collectively or unitedly as the citizens of this country to be able to diminish the impact of the fourth wave in our country. I thank you.
Thank you very much, Susa. We've now got about 20 minutes for questions and discussion. Tessa, there's one comment in the chat around disinformation and misinformation. If I can ask you to deal with that, and then if we could ask if people have questions to please raise your hand. If you don't know how to do it on my MacBook, it's Alt-Y. But just please raise your hand and you'll then be given clearance to pose your question or make your comment. Thank you.
Thanks, Chris. So yes, we have content that goes beyond just the prevention messaging, particularly content that answers questions like why the vaccine was made so quickly. There's a lot of disinformation around that. That actually just explains what the vaccines do and the various vaccines, how they differ from each other. And then we also try and look at some of the bigger touch points in terms of people saying, the vaccine doesn't actually save lives. So we're looking at some of the information that's already coming out around how many people are vaccinated around the world, what the stats are around adverse side effects, and of course, answering questions around particularly the South African experience, where we are not seeing COVID-related deaths, and we're seeing that the scientists are tracking those. So we're going to be compiling a lot of that information as well, and trying to put that into our messaging. We have actually some examples already of existing work that we have that we can share on this. So Dave can just show us that. But yeah, there is already existing work on it that we can show.
There are 3 reasons why the COVID-19 vaccine was made quickly: preparation, money for testing, and new technologies. COVID-19 virus is not the first coronavirus. It's a new kind of coronavirus. The vaccine for COVID-19 was adapted from vaccine development for SARS, a different coronavirus. Money from governments helped to get more volunteers and testing for different things at the same time. Instead of using the virus DNA to make the vaccine, new technology called mRNA is used to make vaccine development easier. Vaccines are safe and help our bodies fight COVID-19. So get your jab today. Wash your hands, wear a mask, keep a distance, open windows.
So that's just an example of one of the video animations, but there are a lot more infographics that cover a wide range of myths, facts, and particularly information around how vaccines work and operate. Chris, do we have any more questions yet?
No, everybody's happy. We've done a good job. We are going to be putting out a media release with the content of what Tessa and I have been saying. We'll try and add the additional information that has come through today. Are there any other questions from participants?
Participants can also write in the chat if they're struggling to put up their hand.
Okay, I don't think we should delay people anymore. There's work to do. There's information products to get out. We really appreciate your participation. Sorry, Nick, I see your hand. Nick Chitty.
Thanks for that, Chris, and thanks, Tess, for that explanation. One of the questions I had really was, are we addressing, because I suspect that that was really good, that video that you produced explaining why it was so quick. But there are many others, like the religious angle. People always make reference to Revelation and the fact that we should actually address that, just to make sure that people recognize, even from a religious standpoint, that there is no good rationale. And even the microchipping, I think we should say practically why it doesn't work. I don't know if you have any material about that. It's also to do with the technology for mRNA, because they keep on maintaining that different deposits that accumulate around the uterus, especially in women, and the fact that it can affect the ovaries and what it actually does to the brain. It might be useful to have some material around that too. So I think there's a long list. I know that it's, the misinformation campaign is incessant and is ongoing, but we have to do what we can to counter them as and when they arise.
All right, I can respond to that immediately, Chris. So thanks for that, Nick. We are fortunate that we are part of a group of people who are getting information around social listening on social media. And so we're responding to misinformation, disinformation that arises from that as it comes up. So the idea is to not just have a toolkit that is ready now to use and then that's it, but to build on things as we go along in the next 6 months. So expect that as ideas come up, as new information or disinformation arises, that we'll be able to address it. But I think it's also important that part of our campaign in the next few months is about creating dialogue spaces. And this is again where media platforms can get involved, because those conversations about, for instance, religious reasoning require more than just one infographic. They require us to listen to people's reasoning around religion and have conversations that engage them more. So I think that that's also a part of what we're going to be trying to do, going into communities with toolkits, but also engaging in radio and other platforms to ensure that we create constructive conversations to engage those issues that can be quite sensitive and not easy to just address in a video. I hope that helps.
Thanks, Tessa. And I think to everyone on the call, if you're a creative and you have ideas, our door is always open. On our website, which is covidcoms.org.za, you can volunteer to be on our distribution team, volunteer to be a creative content generator, etc. And as Tessa says, it's a moving feast. These messages we feel are appropriate for now, but there's a lot more work that we want to do towards the end of this year and into next year, as long as COVID is with us, COVID Comms is with us. So we really would appreciate input and ideas from yourselves. Can I suggest we wrap up? I don't see any more hands. The chat is empty. Just to say thank you very much, particularly to the people, my daughter, Paul, Norman, and Zuza. We really appreciate your support, and we really appreciate the participation of journalists and other interested parties today. Thank you very much.
Thank you, everyone. I'll be ending the call now. If you have any further questions, please do feel free to email us.